Welcome back. Today we are going to talk about, do you need to see a doctor when you are in your 30s? And the answer, you guessed it, it is yes, you should have a primary care doctor while you are in your 30s. 30s are a great time to be alive. And usually 30-year olds are very healthy. However, it is important to have a primary care doctor who knows you really, really well. And there are a few reasons for that. Number one is, so if you get sick, then you can go to your primary care doctor who is familiar with your medical history and who is also familiar with the style of healthcare that you're looking for, right? So not everybody wants to take a pill. Some people want to have a more holistic approach. Some people want to be educated on what's going on with their body. Why are they having these symptoms? Right? So you want a trustworthy physician who you can rely on, who you can reach out to when you are sick. So they can walk you through your symptoms, they can diagnose you properly, they can treat you properly. And if you don't get better, then you can go back to the same doctor. If you were to go to urgent care, number one, you would be treated by different providers every single time. Number two, they wouldn't be familiar with your history. Even if it's in your chart, they can read it. It's not the same as knowing the person face to face. And number three, if you don't get better, then you go back and you see a different doctor, right? So you have to tell your story from the beginning. And because it's so broken, they might not figure out what's going on in a timely fashion. Unfortunately, I see that all the time as an internal medicine doctor. Reason number two to have a primary care doctor in your 30s is to make sure that you are up to date with all the preventive things that you need to do in your 30-year-old. It's not a lot of stuff, but still some things like vaccinations, targeted blood work, things like that. Number three is to keep you motivated and on the right track. So in our 30s, we are, at the top of the world. We feel great, most people. Um, you have a lot of energy, right? You feel invincible. And sometimes because of that, we can do things that are not good for us. We can develop habits that might not be so healthy. So when you go to a doctor, the doctor can go over those, remind you what are the good habits to keep, what are the bad habits to quit. It's kind of like going to a dentist. They keep reminding you, okay, brush your teeth twice a day and floss your teeth. So it's kind of like that. Okay, keep you accountable. And then lastly is, and again, this is just a summary, not all of the reasons. Lastly is do targeted exams and targeted blood work if needed based on your family history. So if there is, let's say, family history of early heart disease, then your doctor might check a cholesterol panel to make sure that your cholesterol is not too high. And if it is too high, they can guide you on what to do, how to keep it low, how to improve it, things like that. I think those are the biggest reasons, I would say, for a 30-year-old to have a primary care, a trustworthy, accessible primary care doctor. If you have any other reasons you can think of, you can drop them in the comments. I will try to read all the comments. And then if you are interested in becoming a patient at our clinic, which is Jersey Family Health, located at 417 Wall Street in Princeton, give us a call at 732-250-9310. We are looking forward to hearing from you. We are currently accepting new patients. It is February 2026 right now.